Welcome to Health Miracles. Did you know hypothyroidism is when your thyroid gland, a butterfly-shaped organ in your neck, is underactive and doesn't make enough hormones? These hormones control your metabolism, energy, and many other body functions. Without enough hormones, you might feel tired, cold, depressed, gain weight, and have other issues. Often, an underactive thyroid is caused by Hashimoto's disease. This is an autoimmune condition where your body's immune cells attack the healthy tissue in your thyroid. This can happen due to gut damage, liver problems, or a lack of certain nutrients. In this video, you will learn about the top 6 vitamins that can help repair the thyroid gland and restore normal hormone levels. These vitamins are selenium, zinc, vitamin D, iodine, vitamin A and B vitamins. We will also share some lifestyle tips to help improve your thyroid function. Top 6 vitamins for hypothyroidism, underactive thyroid. Symptoms of hypothyroidism. Hypothyroidism can cause a variety of symptoms, which may vary in severity. Here are some common symptoms. 1. Fatigue. Feeling unusually tired and lacking energy. 2. Weight gain. Unexplained weight gain or difficulty losing weight. 3. Cold intolerance. Feeling cold more easily or frequently than others. 4. Dry skin, skin that becomes dry and rough. 5. Hair loss, thinning hair on the head and eyebrows. 6. Constipation, experiencing difficulty with bowel movements. 7. Depression, feeling sad, depressed, or experiencing mood swings. 8. Memory problems, difficulty remembering things or thinking clearly. 9. Muscle weakness, feeling weakness in the muscles. 10. Joint pain, experiencing pain or stiffness in the joints. 11. Slow heart rate, a heart rate that is slower than normal. 12. Hoarseness, a hoarse voice or changes in voice quality. 13. Heavy or irregular periods, menstrual cycles that are heavier or more irregular than usual. 14. High cholesterol, elevated cholesterol levels, which can lead to heart problems. 15. Puffy face, swelling in the face, particularly around the eyes. Let's explore the 6 vitamins that support thyroid gland repair. 1. Selenium. Selenium is a vital trace element and antioxidant essential for protecting the thyroid gland from oxidative stress. It plays a critical role in regulating the immune system and preventing damage to thyroid tissues. Additionally, selenium is necessary for converting T4, thyroxine, into T3, triiodothyronine, the active form of thyroid hormone. Low selenium levels are common in individuals newly diagnosed with Hashimoto's thyroiditis and hypothyroidism. Supplementing with selenium has been shown to reduce thyroid peroxidase (TPO) antibodies, which are associated with Hashimoto's disease. While lowering TPO antibodies does not cure Hashimoto's, it helps mitigate the autoimmune attack on the thyroid gland. Research from 2023 indicates that adding selenium supplements to levothyroxine therapy, a common treatment for hypothyroidism, can significantly enhance thyroid function. 2. Zinc. Zinc serves as a crucial catalyst for more than 100 enzymatic reactions in the body, supporting processes such as protein synthesis, DNA synthesis, growth, and tissue healing. Unlike some nutrients, our bodies cannot store zinc, necessitating regular intake through diet or supplements. Individuals with hypothyroidism, particularly those with Hashimoto's disease, often experience zinc deficiency. This deficiency can disrupt thyroid function by increasing oxidative stress and promoting inflammation. 3. Vitamin D. Vitamin D is renowned for its role in maintaining bone health and preventing osteoporosis. Beyond this, it also helps reduce inflammation and supports a robust immune system. Research suggests that vitamin D deficiency may contribute to symptoms like joint and muscle pain, as well as conditions such as leaky gut syndrome. Leaky gut syndrome is often seen as a precursor to autoimmune disorders like Hashimoto's thyroiditis. Increasing your vitamin D intake can aid in the repair of your digestive system by promoting the closure and healing of gaps between cells. This healing process helps prevent toxins from leaking into the bloodstream. A study in 2018 demonstrated that individuals taking vitamin D supplements experienced significant improvements in their TSH, thyroid-stimulating hormone, levels compared to those taking a placebo. 4. Iodine. Iodine plays a crucial role in maintaining thyroid health and function. The thyroid gland uses iodine to produce thyroid hormones, namely thyroxine, T4, and triiodothyronine, T3. These hormones are essential for regulating metabolism, growth, and development throughout the body. Adequate iodine intake is necessary to prevent iodine deficiency disorders, such as goiter and hypothyroidism. However, while iodine deficiency can lead to thyroid dysfunction and enlargement, goiter, excessive iodine intake can also disrupt thyroid function. 5. Vitamin A. Vitamin A, also known as retinol, is a fat-soluble vitamin essential for vision, immune function, and regulating inflammation in the body. It plays a critical role in activating thyroid hormone receptors within cells, facilitating the uptake of T3, the active form of thyroid hormone, from the bloodstream into cells. Research from 2022 highlights that insufficient vitamin A levels can disrupt thyroid hormone balance by increasing thyroid-stimulating hormone, TSH, secretion, reducing iodine uptake, impairing the conversion of T4 to T3, and limiting T3 uptake in cells. However, supplementing with vitamin A has shown promise in reversing these effects. In a 4-month trial, vitamin A supplementation led to a reduction in serum TSH levels, suggesting support for the pituitary gland and potential prevention of thyroid gland enlargement. Animal studies further demonstrate that vitamin A supplementation can decrease thyroid volume, lower TSH levels, and improve iodine uptake by the thyroid gland. Ensuring adequate vitamin A intake through supplements or dietary sources may play a beneficial role in supporting thyroid health, improving hormone balance, and optimizing overall thyroid function. 6. B vitamins. B vitamins, including vitamin B12, are crucial for maintaining a healthy thyroid. Adequate absorption of B12 relies on a healthy gut, which is closely linked to thyroid health as mentioned earlier. Vitamin B12 plays a critical role in supporting a healthy nervous system, sustaining energy levels, and preventing anemia when levels are low. Studies indicate a connection between vitamin B12 deficiency and Hashimoto's thyroiditis, with higher thyroid antibodies often seen in those with lower vitamin B12 levels. Additionally, research has shown that approximately 40% of individuals with hypothyroidism also have a deficiency in vitamin B12. The recommended dietary allowance, RDA, varies for each B vitamin. While many people can obtain these vitamins through the diet, issues with gut health or absorption, or following a strictly plant-based diet, which lacks B12, may necessitate supplementation with a B complex. Supplementing with a B complex can be beneficial in ensuring sufficient intake of B vitamins, supporting overall thyroid function, and addressing potential deficiencies associated with thyroid disorders. Here are some lifestyle tips that can help improve thyroid function. 1. Eat a balanced diet. Include nutrient-dense foods rich in iodine, seafood, dairy, selenium, Brazil nuts, fish, meat, zinc, meat, shellfish, seeds, and vitamins B12 and D, fish, dairy, eggs, to support thyroid health. 2. Manage stress. Practice stress reduction techniques such as meditation, yoga, deep breathing exercises, or hobbies that promote relaxation. 3. Exercise regularly. Engage in regular physical activity to support metabolism and overall health. 4. Get sufficient sleep. Prioritize good sleep hygiene by maintaining a regular sleep schedule, creating a relaxing bedtime routine, and ensuring your sleep environment is conducive to restful sleep. 5. Limit exposure to toxins. Minimize exposure to environmental toxins and pollutants, including cigarette smoke, pesticides, and heavy metals, which can disrupt thyroid function. 6. Stay hydrated. Drink an adequate amount of water daily to support metabolism and overall cellular function. 7. Monitor medications. Ensure any medications or supplements you take are thyroid-friendly and do not interfere with thyroid function. 8. Regular thyroid checkups. Schedule regular visits with your healthcare provider to monitor thyroid function through blood tests and adjust treatment as needed. 9. Educate yourself. Stay informed about thyroid health and conditions, and work collaboratively with your healthcare team to manage and optimize thyroid function. The bottom line: enhancing thyroid function involves supporting vital nutrients and adopting healthy lifestyle habits for overall well-being and improved hormone balance. Consistent attention to nutrition and lifestyle choices can contribute to optimal thyroid health and overall wellness. Thanks for watching. For more health tips and updates, don't forget to subscribe to our channel.